Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. Today we will be starting with the module 3, that is Patient Safety Management, Infection Control and Medication Safety. In the chapter 26 in the Infection Control Practices part 2, we will be discussing on the need of surveillance in infection control programs, aseptic techniques in healthcare, and we will be discussing more on the infection control programs in detail. To ensure that an infection control program is functionally properly, the surveillance need to be an integral part of all the health programs that your organization is taking. This surveillance program is one to monitor the incidence and nature of the HAIs. In the previous chapter, we have seen actually an hand washing which is more related towards reducing the HAIs. And now we will be seeing the importance of surveillance in the infection control program. This surveillance programs helps actually to enable the performance audit of infection control practices, provides a feedback system to assess the functioning of the program, enlarging, we can say, in the early recognition of the problems that you come across. It helps to minimize the infection occurrence. It supports the concentration of correcting of the errors in practice and workflow. So, what are the factors to consider while developing a service programs? We can say the characteristics of the institution, the organization which has a volume like total number of the beds, hospital type, whether it is a public, private, teaching, community based or general or super specialty. Patient population served, how and in what volume it is being served. What are the procedures and the treatment that are offered over there? What is the proportion of inpatient versus outpatient care? What are the resources available, which are including the budget, number of the personals in the institution, and the level of training and experiences of infection control staff will make it more towards considering what sort of factors we are really dealing with in developing a surveillance program. Next line, in factors to consider while developing a surveillance program, you may say that your surveillance system should allow staff to continue with the essential function like education, developing interventions, and monitoring efficacy. Budget and resource limitations. Most infection control programs have limited budgets. And we find most of the organizations which are struggling are more only because of the limited budget. The staff must plan carefully to use the resources to their maximum advantage rather than not just spending with this and it get lapse. So what is the scope of routine surveillance versus actually which a hospital takes as something type of pressure surveillance? So routine surveillance should be comprehensive or hospital wide, not only limited to one department. It cannot be seen as an experiment, rather taking it a massive or a campaign towards the entire institution. It should be targeted, focusing on specific processes. It should have outcomes of important infections, or it should even be seen in high risk pathogens. Patient group significant to the institution. So this can be seen as a target where it starts from the specific processes, outcomes, high risk pathogens, and even patient group significant to the institutions. So surveillance should prioritize infections that can be prevented at first. Second is like the occurrence which are having frequently. The third is causing serious morbidity and mortality. Many times it is being seen that this is the very important thing, that if the infection control committee is targeting with this, you may find the benefits of surveillance will give you major advantages of this. It is being seen that the surveillance, they are costly to treat, and sometimes you may come across that organisms which are resistant to multiple antimicrobials can also be prioritized actually, where you can find the benefits of this surveillance program getting more. So now we'll try to we put you to the infectious disease matrix and rates, which is very important for every quality control team to understand, where your central line associated bloodstream infection, that is CLABSI, where you can find it like CLABSI rate per 1000 central line days is equal to number of CLABSIs divided by number of central line days multiplied by 1000. So the formula will be center line utilization rate is equal to number of center line days divided by number of patient days. And the next comes the catheter associated urinary tract infection, where you find after CLABSI you may come across with this as a major infection, where you can take the COTI rate as per 1000 catheter days of a patient is equal to number of COTIs divided by number of catheter days multiplied by 1000. If you have to take it in a formula, that can be urinary catheter utilization ratio is equal to number of urinary catheter days divided by number of patient days. Then if you have to see the ventilator associated pneumonia, that is VAP, which is also one of the major problem of superbugs, you may see the VAP rate can be seen per 1000 ventilator days is equal to number of VAP days divided by number of ventilator days multiplied by 1000. And the formula can be seen as ventilator utilization ratio is equal to number of ventilator days divided by number of patient days. Then comes the surgical site infection, that is SSI rate. SSI rate is per 100 operational procedures. So the formula can be is equal to being seen as number of SSIs divided by number of specific operative procedures multiplied by 100. So you can find these are the very important statistics that your hospital infection control team needs to take care, and regularly they need to note actually to see the improvement actually, which can be seen as a regular task of the surveillance part. The infection control surveillance can be seen as a strong room actually, or you may say as being seen as collecting information, that is data collection and the analysis, which is the major core work, where you may find on based of that you may get the reduced infection. On the base of the feedback, you may come up across actually an intervention. So you may find this cycle will go on, because you may come across infection again and again, and your infection control surveillance programs will be a continued program. It cannot be a one time or a task based actually, it should be more on target based. The interventions which are to be productively coming out of this infection control surveillance activity in your hospital or healthcare should deal more based on the feedback, and the analysis will be supported actually with the data collection that is being done with the help of the statistics which is discussed, and you will find a great reduction in infections. Now we will be discussing on the aseptic techniques, a general term for practices used to minimize the introduction of microorganisms during patient care. There are two types of aseptic techniques, that is general asepsis that applies to routine patient procedures outside the operation theatre. One is outside the operating theatres, that is OT, and one is in the OT. The second is surgical asepsis. This type relates to the procedure intended to prevent surgical site infection. So you may see that it starts from OT to the ward. So importance of the aseptic techniques is like reduces risk of post procedure infection. You may find lot of post surgical or post procedure infections are more dealt with the aseptic technique. This technique minimizes the exposure of healthcare workers to potentially infectious microorganisms. What is the scope of this aseptic technique? It includes practices performed before, during, and after invasive procedures. So, in the first to my right actually you may see the general asepsis, and on the left you may see the surgical asepsis. A aseptic technique towards preventing infection, where you may come across actually these two techniques as to be seen as very important to tackle the infection and to prevent it before it happens, where you may see the major role of the healthcare workers comes when you are doing the planning, you may lead to a major success with this. What are the consequences of poor adherence? If you don't do adherence actually to this, you may lead to significant amount of morbidity and mortality. Even countries with strong infection control program faces HAI due to poor asepsis. The examples in the USA, where the surgical site infection are the third most common cause of HAI, that is 14 to 16% of all the HAIs are mostly because of surgical site infection. Evidence from India, if you have to talk, it is limited national data which is available on the surgical site infection rates. But whatever study we come across, it is majorly that India also face a voluminous burden of more than 25 to 30% of all the HAIs which comes into our record. Other studies also show poor compliance with respect to aseptic technique during the critical procedures. Examples can be extrinsic contamination of IV fluids is seen in ICUs, even in the obstetric wards and even the dialysis centers. Reuse of needles, syringes has led to transmission of blood-borne infections, HIV and HCV. Need for policies and training to tackle this. The healthcare facilities must establish policies for aseptic procedures. Personal performance, these procedures must be more emphasizing on training of the aseptic techniques, demonstrating the competency. The staff must understand why aseptic techniques are very essential. What are the organizational requirements to tackle this issue? Hospital leadership must ensure adequate supplies. They should provide proper equipment and make it more available regularly. Along with that, supervision and monitoring of the aseptic practices is a critical part of the infection control, and it needs to be taken as a culture of developing towards making these practices more responsible and practice oriented. So at the end of this chapter, I would like to emphasize and say that surveillance is an essential for monitoring healthcare associated infection and ensuring that the infection control programs work effectively. Your surveillance at the healthcare institution should be targeted. It should be targeted focusing on high risk, frequent, preventable, or antimicrobial resistance infection. This should be one a planned and most towards a target, coming up with the strategies which has to be dealt with all these areas which are making sometimes more difficult for the infection control team to take ahead. All the healthcare associated rates, that is CLABSI, COTI, VAP, or surgical site infections, are calculated per 1000 devices days or per 100 procedures for standardized comparison, which is very important. When you have to improve, you have to have a statistics. Without that, the functioning of working is really not supportive. Aseptic technique minimizes microbial contamination during patient care procedures. Poor adherence to aseptic practices leads to increased morbidity, mortality, and transmission of serious pathogens. Healthcare facilities must have a clear policies, training, supervision, adequate supplies to ensuring the compliance for this part. So in the end, we can take the benefits of these references to prepare your projects or even read in more detail in understanding what an infection control program need to be taken by a healthcare worker. So thank you, and thank you for this.